Welcome to this explainer. Today, we're decoding diagnostic ultrasonography. It's this incredibly powerful medical technology that honestly feels almost like magic. We are literally turning simple sound waves into a real-time map of the human body. So let's start with a really crucial question. How exactly do doctors use invisible sound waves to safely look inside us? How do they diagnose these super complex issues without making a single incision? Like, how does a simple pulse of electrical energy transform into a real-time, moving window right into the human body? To answer that, we're going to follow the sound wave's journey across 4 stages. The magic of transducers, how tissues change sound, decoding the ultrasound screen, and finally, real-time medical applications. Let's dive in. Part 1. The magic of transducers, translating electricity to sound. Okay, so the absolute most essential piece of equipment here is the transducer, which you'll usually hear called the probe. This little device is basically the ultimate two-way translator. First, it converts electrical energy into sound waves, sending them right down into the body. But its job doesn't stop there. It then acts as this highly sensitive receiver, catching the returning echoes that bounce back so it can investigate our soft tissues. But right at the surface of the skin, we run into a critical physics problem. The probe is sending waves into soft tissue, but it absolutely requires a medium to travel through. If there's even a tiny pocket of air between the probe and the skin, well, that air just blocks or reflects the waves entirely. You get nothing. And that is exactly why doctors apply that freezing cold special gel. It acts as the perfect acoustic bridge, completely replacing the air so the sound can seamlessly enter the body. Now, depending on the mission, doctors have to choose different tools to get the best picture. They're going to use a linear probe when they need to view superficial structures, stuff sitting right near the surface of the skin. On the flip side, they'll swap that out for a curved probe when the goal is to penetrate much deeper, like when they're investigating internal organs far down into the body. Moving on to part 2, how tissues change sound, the physics of the echo. Once those sound waves are actually traveling through the body, they react completely differently depending on what they hit. For instance, when sound hits fluid, it just passes straight through without bouncing back to the transducer at all. We call this phenomenon anechoic, and that literally translates to no echo. Because the wave passes entirely uninterrupted through that fluid medium, 0 echoes are sent back to the probe. It is basically complete acoustic silence. Conversely, though, we've got structures that behave in the exact opposite way. When the sound wave smacks into dense structures, think a bone, a kidney stone, or even pockets of trapped air, it bounces back forcefully to the probe. We call this hyperechoic, meaning more echo. So the big takeaway here is that some materials let sound pass in total silence, while dense barriers and air send massive sound wave reflections right back to the equipment. Which brings us to section 3, decoding the ultrasound screen, from physics to visuals. All right, first things first, we've got to understand the visual map of the screen itself. If you imagine looking straight down from the skin into the body, it's actually a very logical layout. Whatever is superficial, meaning it's closest to the probe right at the surface, well, that's displayed right at the top of the screen. Conversely, the middle or deep tissues that the sound waves had to travel further to reach, those are plotted all the way down at the bottom. So here's how all that physics actually paints the picture for us. Remember that anechoic fluid that lets sound pass right through? Because there are no returning echoes, it renders completely black on the monitor. But those dense, hyperechoic barriers like bone, air, and stones, they're sending massive reflections back so they appear stark white. It's just a stunning visual contrast driven entirely by tissue density. Finally, section 4, real-time medical applications, ultrasound in action. Using this technology, a doctor isn't just staring at empty black spaces on a screen. They're actually analyzing detailed cellular environments, kind of like a detective. For example, they can actively investigate whether a fluid is a simple transudate or a complex exudate. How? Well, an exudate fluid actually contains these distinct, tiny fibrin strands hiding right inside it. The sound waves hit those tiny strands and send echoes back. This lets the doctor spot them on the screen and accurately pinpoint the exact type of fluid they're dealing with. It's really incredible. And because of how air and fluid behave inside the human body, doctors know exactly where to look for specific problems. It's incredibly clever, actually. They just use gravity to their advantage. Say they suspect a pleural effusion, which is an accumulation of fluid. They're going to place the probe on the posterior inferior thoracic region, basically low on the back, because, well, fluid naturally sinks. But if they're looking for a pneumothorax, which is trapped air, they'll place the probe anteriorly on the front of the chest because air naturally rises. By identifying these distinct visual differences, the ultrasound becomes so much more than just a static diagnostic map. It actually provides crucial, real-time guidance. During delicate procedures like a thoracentesis, a doctor can clearly see the black fluid versus the stark white bone and air. That contrast allows them to safely guide a needle to the exact right spot, all while entirely avoiding the dangerous areas. It is a total game changer. This all leaves us with a truly provocative thought. If manipulating simple sound waves gives us such a powerful, non-invasive window into our anatomy, literally allowing us to decode invisible echoes and safely guide needles in real time, what other medical mysteries will these echoes solve next? Thanks so much for joining me for this explainer.